helping you lead a healthier life. This is Kara's Cures.
Welcome to the Kara's Cure Show, where we explore the cutting edge of wellness for our mind, body, and spirit. I'm Kara Sundlin, and today we are tackling the ever-expanding subject of menopause, what holistic solutions exist to really help women through this transformative time, which you might not realize can actually start 8 to 10 years before the actual pause. So I'm joined by Dr. Melanie Carminati about holistic treatments, including what you might not realize, physical therapy for the more than 1 million women who are entering menopause every year. Welcome. Really, more than 1 million women every year.
Yes, yes. Thank you so much, Kara, for having me. It is something that affects so many women, and many women, when they're in their mid-30s, they start feeling some symptoms. It could be psychological, it could be gastrointestinal, it could be musculoskeletal, so it's multiple systems in the body that are impacted by perimenopause, menopause, and then postmenopause.
Yeah.
So,
and we're going to really take a deep dive, because if you've maybe noticed, it used to be something that nobody talked about. Now, on my Instagram feed, on Facebook, which is actually a good thing, Oprah, everybody's talking about menopause.
Yes.
It's actually become, I know, an investment thing. There are a lot of companies, so you want to be careful about not just having someone make money off of you. But it used to be something that I think as a young woman, you heard a lot about puberty, but nobody ever talked about what happened later. And it really is almost like a second puberty for women, right?
Absolutely. So it is a big transition in hormones. So with that transition, just like through puberty, right, that's a transition there. You experience different things, as I mentioned, different systems in the body are impacted. And specifically with menopause, there's different psychological and biological changes that happen. Psychological could be mood. You could be feeling different mood changes. Some of my patients at Inspira in Brooklyn mention that that's the most challenging for them.
The mood, yeah. Definitely, you know, the idea that it would be really normal if you're having mood swings or irritability or insomnia.
Yes, exactly, exactly. So some of the things that we do to help with that target the autonomic nervous system, specifically the vagus nerve, which is the main nerve in our body that helps to regulate all these things. So autonomic means like automatic and like heart rate, blood pressure, things like that. Some hands-on techniques, osteopathic techniques like craniosacral therapy, visceral manipulation, and vagus nerve manual-therapy really help with managing these symptoms.
It's so interesting, because I think when you think of physical therapy, you think of pain, which you have a clinic not too far from us in Brooklyn, New York, that specializes in people living with chronic pain.
Right.
But I wouldn't think of physical therapy for menopause, yet this is a growing field, because you're actually helping holistically for both the psychological and physical symptoms?
Absolutely. So psychological I just touched on, but there's some physical symptoms specifically related to sex. So sometimes as we age, well, not sometimes, but all the times, our tissues in our vaginal area changes. So it can become dry, lose elasticity, and this impacts comfort during sex. And so some of the things that we work alongside with gynecologists on, sometimes they might prescribe a local vaginal estrogen, but when they come to us for pelvic floor physical therapy, which I have the pelvic model here, I could break that down in a little bit, but we will work on some of those tissues to help promote circulation in the area, help to regain that flexibility, which helps to alleviate the symptoms as well.
So we're gonna take a deep dive into health. That's what we do here. So no question off topic and nothing. I know you're very comfortable talking about all this.
Yes.
Certainly, women for so long has just been like, oh, down there,
Yeah.
and you really want to change that. I mean, that's one of the reasons you brought this model, because I don't know that anyone has ever talked to me about the changes in a pelvic floor muscle, or why it would matter, or other than people talk about Kegels. Is that what you're talking about?
Right. So this is a great question, because many times people think that pelvic floor physical therapy is just doing Kegels, which is actually not the case. There's many times where Kegels are not recommended, and it can be contraindicated for people. So for pelvic floor physical therapy, it's very medically based. First we talk about symptoms. How are your urinary symptoms? How are your bowel symptoms? How is sex? Gastrointestinal. Have you had any kids? How are the deliveries? Things like that. Is there any complex hip, low back pain that hasn't gotten better? Sometimes there's a pelvic floor root to that. And so after all of that, we do an overall assessment of posture, breathing, lumbar spine, because your pelvic floor is actually part of your core. That's a common misunderstanding when people do, core strengthening. Sometimes they're just targeting the six-pack muscles, which are nice for postural things and like strong motions, but the deep core, it's our pelvic floor, diaphragm, transverse abdominis, and lumbar multifidi. I'm saying all these anatomical names. I know people might not know them, but most people have heard of the pelvic floor.
Yeah.
And so the pelvic floor, there's multiple layers. There's three main layers that we break down. What we see here in this pelvic model, this is a female pelvic model, we can see the first layer muscles. And so I like to describe the pelvic floor as three hammocks stacked one on top of the other, and then there's different openings. For a woman, you would have urethral opening, vaginal opening, rectal opening. So for a man, they wouldn't have the vaginal opening, but it's all the same muscles in men and women.
Men have pelvic floor muscles also.
And they sure do.
Okay.
Yeah.
So it's all, the muscle would be the red part here. These are the hammocks.
Exactly.
And when you're young, those are strong and tight. And as you get older, like any other muscle, they might become more relaxed, or and if they do, if your pelvic floor muscles are not strong, what would your symptoms be?
Right. So your pelvic floor is really unique in that sometimes the muscles can actually be tight and weak.
Okay.
And that's one of the reasons why sometimes doing Kegels isn't the right thing for everyone.
Okay.
But as you age, specifically, if you are not sexually active, if you didn't have any vaginal deliveries, sometimes the tissue could be getting tight from that, and that could be causing the weakness, which then could be causing symptoms like pain during attempted intercourse, or during bowel movements even. But with the pelvic floor musculature, when we're doing the manual therapy, we're going to be palpating externally, and then with permission internally to feel the muscles for specific tender points.
How does someone know if they need this help? Is there a test that you would do?
Yeah, so we would just talk to them first. A lot of it is just symptom-based and what the patient reports, and that will give us some information. And then if people haven't gotten better with traditional physical therapy, they typically will come to us.
So physical therapy, though, I think when people are hearing a lot more about menopause, and they're hearing about some supplements they might want to take, the importance of eating protein and working out at the gym, but people aren't necessarily talking about the internal. So would this type of physical therapy help most women who are perimenopause, menopause?
Right. So as you were just asking before, when women age, when anyone ages, our muscles change. We lose that elasticity, like I mentioned. So some people, they might be tight and weak. Some people might have some prolapse going on, which there's different types of prolapse where organs start to, we mentioned that this is a hammock, but it will be like even more of like a stretched hammock into the pelvic floor musculature. This can happen with your bowel habits, with your urinary habits, after vaginal deliveries, after abdominal surgeries. So everyone's presentation will be different. Not everyone will necessarily have loose pelvic floor muscles. Not everyone will have tight. It's very subjective, and it's very unique case by case.
Okay. And what age do you see with women who need this and who can really benefit?
For pelvic floor physical therapy in general, all ages.
All ages.
Yeah.
And specifically those who might be needing it for either perimenopause or menopause.
So we have women who are coming in their mid-30s, through their 40s, and then afterwards.
So what if you're listening and you're beyond menopause, but you're thinking, no one told me this, and I wish one of the things you told me is that women come because they don't want to leak when they laugh, or things like that. Can you heal?
Sure, absolutely. So leaking when you laugh, when you jump, when you exercise is something that can be managed with pelvic floor physical therapy. So for women who are postmenopausal, they can still get benefit from pelvic floor physical therapy with that. And there's many women who are coming to me right now who are well after menopause. Their last period was many, many years ago. And they have already gone through some of the hormonal transitions, but they still are having symptoms in the pelvic floor. They're having some of the urinary incontinence. They're having some of the bowel dysfunction, and it can help tremendously.
Okay. So a lot of times when we think of digestion dysfunction, bowel dysfunction, we've done a lot of shows for IBS about changing your diet, eating the right foods.
Right.
And what you're saying is sometimes there's another layer that even when you do those things, you don't get full relief until you do address some of the physical problems?
Absolutely, yeah. So if the muscles have been working in a certain way, say there's something called dyssynergic defecation, which just means that the muscles in the pelvic floor, for when you have a bowel movement, instead of doing a relaxation, they're actually contracting. If your body has been doing that for years, months, or however long, there's going to be a phase that we need to do retraining of the muscles.
So how is this ever covered by insurance, and how long would it take to quote unquote be done or be healed or have a difference?
Yeah, so everyone's case is different. The longer you've been having symptoms, typically it might take a little bit longer. So as soon as you have some of the symptoms that I mentioned, it's best to try to get in to see a pelvic floor PT. At my practice, we take Medicare. So if you are on Medicare, we can see you for pelvic floor physical therapy. And then there are some practices that accept insurance, but for us, we work out of network with other insurances.
With other people, okay.
Yeah.
And your practice, are you unique? I want to let everyone know,
Yeah.
You're right across state lines in
Yeah.
Park Slope, Brooklyn. But do you
Yes.
find people coming from Connecticut and other states because it's not
Yeah.
common to have a pelvic floor physical therapist?
Yes, so many people come to us from Staten Island, Long Island, upstate New York, all over the place, especially because at our practice in Spira, we do so many things, different manual therapy techniques, pelvic floor physical therapy, and Pilates exercise integration. So they really come for the specialization of what we do.
Yeah. How long does a typical course take so you can notice differences?
So we typically have people book for 8 weeks, once a week.
Okay.
Because we are specialized, we spend the full hour with our patients. So it's undivided attention. You won't be left alone in a gym. And especially for pelvic floor PT, everything's happening in a private room. So 8 weeks is what we say is the first course of treatment. Sometimes people start seeing changes around 4 weeks, sometimes even sooner, but typically 8 weeks is the standard. But again, if it's been ongoing for a long time, it might take more than 8 weeks.
What are some of the benefits of doing physical therapy for perimenopause and menopausal symptoms? Like, what will you notice gets better?
Yeah, so physical therapy in general, some of the things that we're thinking about when we're thinking about menopause is bone health. So osteoporosis, osteopenia, all of these things. So for general orthopedic physical therapy, strengthening, resistance training, balance training, posture, all that fall prevention stuff, core strengthening to help the bone stay strong is important. There's many things that the National Osteoporosis Foundation recommends for osteoporosis management and prevention. One of them is having a daily walking program. The other is having resistance training. The other is balance training. The other is to be doing some kind of postural-based exercise because we don't want to end up in that rounded posture, right? As we sit up a little bit taller.
As we sit up a little straighter in these chairs, which are a little difficult to sit straight on. But yes, when you're engaging your Pilates muscles, yeah.
Definitely engaged here.
And I think so often as women, we think, yeah, that's for my mom. But you would say women in their 30s need to be cognizant of this.
Absolutely. The sooner that you can be doing exercises, either general for bone health or even pelvic floor specific. Say you're a woman in your 30s who's had 2 vaginal deliveries, you might be leaking urine here and there and you never saw a pelvic floor PT. It's in your best interest to at least go in for an evaluation. See how your pelvic floor is doing, so you know what you need to work on so you can prevent some of the progression of symptoms.
I mean, I don't think that traditionally your doctor says to go do this. So you'd have to advocate for yourself, right? And how do you even find that pelvic floor evaluator? I know we have you in Brooklyn, but I mean, is it common that people could just go ask their OB and get referred?
So what I'm finding is that the younger physicians tend to be more in the loop about pelvic floor PT and refer out for it.
Okay.
And additionally, if you live in a city, it will be easier, like New York City, there are many pelvic floor PTs. But as you move towards the suburbs and then more rural, it is much more challenging to find someone who specializes in this because it takes a lot of extra training to be able to treat someone for pelvic floor PT. So, yes.
And this is something that has been an emerging field, but talk a little bit about your background. You came out of this from being a dancer and a Pilates expert, which we're also seeing something, if you're watching your social media feeds, a big move towards strength-based Pilates as a cure for so many things.
Yeah. So yes, I was a dancer, and then I became a Pilates teacher, and then I became a doctor of physical therapy. And so my journey was very mindfulness-based. I also practice meditation. We recommend meditation a lot to our patients as well for stress management, pain management. But in terms of Pilates, it is an amazing total body strengthening system. I call it a mind-body movement method because you have to be very much in your body to be doing the exercises properly. And then after you've had that movement sequence where you've been mindful and in your body, you just have this like after Pilates energized vibe for the rest of the morning or afternoon.
I've done more yoga than Pilates, although I have done some Pilates videos on my own. But the same thing with yoga, which some of the moves are very similar, but you just get something more out of it. I joke that it's sort of mental health therapy and working out in one, because the feeling you have afterward is a very calm, de-stressed feeling, different than if I go do a HIIT workout.
Absolutely. So breath is the first principle of Pilates. And so as in yoga, they use the breath a lot as well. It helps to center you, ground you, get you in your body. Many times throughout our days, we're disconnected from our bodies. You know, it's very easy with email, social media, all of these things that are giving us stimulation to get disconnected from our physical body. So breath is super important to staying in your body and getting in your body. And it's the first principle in Pilates, so it's extremely helpful for that. And it is part of the contributing factor for why you feel afterwards relaxed and just calm, because you've been in your body for that time.
You know, there's really a movement to both at the federal level, I know the White House is working on this, and then even conversations with folks like you, to improve women's health. And part of that would be improved knowledge, not just, oh, get your colonoscopy a little earlier or do your breast exams, on another level. So if you could make a wish, say, that people are listening to this, do you think every woman after she has a child or every woman at a certain age should get evaluated with their pelvic floor? And what are some things you'd like to see women really understand and do more of to protect their health?
I was just having a chat with one of my best friends on the way here, and she was saying, I wish that there was more knowledge about pelvic floor PT, because many women don't know about it, and they should be going to pelvic floor PT before they give birth.
Oh, before? Why before?
Because if their goal is to have a vaginal delivery, which many women do, it will help them learn how to use the muscles in the pelvic floor. So we know that the uterus contracts when you're in active labor, but your pelvic floor muscles are also actively pushing down. You know this when you're cued to push. So it helps tremendously with just feeling comfortable, and then also helping to reduce potential tears.
Even, apologize, that might be, as long as you can still hear me. That's what happens when sometimes on live TV our microphone falls, folks. But as long as you can still hear me, we're good. Would this also be good for folks who, if they have had a C-section, would they still need this?
So people who have had C-sections, they typically will come in after the 6-week follow-up, and then we can start different assessments of the abdomen, check to see if they have diastasis recti abdominis, which is a common thing that happens where you have the separation here. Sometimes you have a little bit.
Sometimes you have to have surgery after for that, right?
Sometimes, but if, depending on the person, if we can work on it soon enough, we can help to promote the closure. Of course, everyone's situation is different, but I have had success with helping people close without surgery.
A lot of women are also, it keeps happening and I apologize.
That's okay.
That's my bad. I think I'm just sitting on this the wrong way. I apologize, everybody.
Okay.
But let me ask you, if you are a woman also being talked to about doing a pelvic floor surgery for either prolapse or for urinary incontinence, would you do pelvic floor therapy first instead?
Absolutely. Most urogynecologists actually refer to pelvic floor PT first to see if the symptoms of the prolapse will reduce. So depending on the stage of the prolapse, typically grade 1 and 2 do the best with pelvic floor physical therapy in reducing and managing the prolapse. But if it is progressed beyond stage 2, typically surgery is indicated. Sometimes people will just use pessaries, which is almost like there's different types, but most common type is like the donut type. You insert it like a tampon and it just holds up the tissue there so that you don't experience the symptoms.
And then just even the idea for, because I'd like to keep this really accessible and even 101 for women.
Yeah, of course.
If you've been going to your OB once a year for your annual, which is important, just did mine, you might not even know what a urogynecologist is.
Yeah.
And so we should be having these conversations. You might need a referral, but a urogynecologist is really going to take you deeper into a lot of issues women may be facing as they age.
Yeah, so women are going to their annual gynecology visit, OB-GYN. They can bring up their symptoms to them if they're feeling pressure or heaviness. Talk to them about treatments. OB-GYNs can help with it as well, but urogynecologists will have more options for people who aren't getting relief in their symptoms with whatever was prescribed by the OB-GYN.
Okay.
Yeah.
Since you're more focused on holistic solutions, how do you feel about what if the doctor has recommended a mesh surgery or something like that that will instantly relieve things?
Yeah.
Is that okay?
Yeah, of course. Case by case. I've had patients who had previous abdominal hernias, specific for diastasis recti abdominis, and they have the surgery and it relieves, or pelvic floor specific. Everyone's case is different. Not everyone can be managed with conservative treatments like the ones that I'm mentioning, but it is definitely an option to consider and to try first before surgery.
So what do you wish women from age, say, 30 on knew? What would you, what would you like to change so that women could start doing what you know to do?
I wish that women would become more informed about their pelvic floor, informed about some of the symptoms that they're having so that they know that there are things that they can do to relieve them. And then I wish also that women would be informed about some of the bone health changes that happen and start to happen in our mid-30s.
In our mid-30s.
In our mid-30s, yeah.
I heard that our bone mass is really at its peak at age 30.
Yeah.
So after that, even 30 is so young, but after that, you're going to start losing bone mass.
It's true.
And what would we do to prevent that?
Yeah, so from a physical standpoint, from a musculoskeletal standpoint, exercise is so important. What happens when you do weight training and resistance training is it puts excess stress on our bones. Our tendons connect the muscles to the bone, and that pull helps to stimulate the bone builder cells. And so those cells start to work more, keep the bone density. So weight training is very important for women. Because I know that many women even avoid weight training because they don't want to look too big, but it is very important for women's bone health.
And in fact, women don't generally get that big from weight training. I know from doing enough stories on that. We don't have that testosterone and other ways to get really big, but it can actually really help our metabolism. So the days of where women used to think, don't eat very much and do tons of cardio, that's actually damaging. We really need to have, how many times a week a strength training workout?
At least 3 times a week.
Really? And Pilates would count?
Pilates would count as some strength training. It depends what level class you're taking. It also depends how long the workout is for. So it still is important to have a separate weight training exercise program as well.
Okay.
Yeah.
So even you, as a Pilates instructor, you'll still lift weights, actual weights.
I do.
Okay. And this doesn't have to be a lot. You might incorporate 15 to 20 minutes of one day you're doing squats, the next day you're doing arm exercises.
Right.
But just adding that element of strength could really change our prognosis as we get into our 40s, 50s, 60s, and 70s.
Right, absolutely. And so we're mentioning weight training, but there's also body weight training. So the squats, the jumping, push-ups, planks, All of these things are also super important for strengthening the bones.
Okay. Talk a little bit about, as we only have a few minutes left, people could come to you for an evaluation, right? And there may be, I guess, would people just Google, if they really can't get to New York where you are in Park Slope, would you Google pelvic floor physical therapist?
Yeah.
Okay.
There is a network. Herman and Wallace has a pelvic rehab practitioner database where you can look for a practitioner near you who has trained in pelvic floor PT. So you can definitely do it that way, looking on their database. Or you could just Google. Google is a good source for finding. Yep.
And then you want to make sure, if you want to go to a good one, is there any certification we need to be looking at, or what do you want to make sure that we're going to the right person?
So you want to make sure that they've trained and taken courses with either Herman and Wallace or the American Physical Therapy Association. Those are the two main training bodies. The certification isn't required. There's very few practitioners who have it, but they have to be trained through these two main schools of training.
Specifically for pelvic floor physical therapy?
Yes, yes.
Okay. And shout out your place, your website, all of that, so people can connect with you if they'd like.
Sure, absolutely. So Inspira Physical Therapy, we are on Instagram at Inspira Physical Therapy. We are located in Park Slope, Brooklyn. Our address is 275 4th Avenue, Brooklyn, New York, 11215 in Park Slope. And you can call us at 929-295-6566. You can also text that number too. Our website is brooklynphysicaltherapy.com. We're on YouTube. We're on TikTok now. So we're accessible.
You're accessible. And what about if you're not going to go to a therapist? Maybe it's not in the budget. Maybe you're not going to have time. I just want to, you want an entry in. I mean, we've certainly been told, although interesting you said depending, we may Kegels might not be the best thing. But besides strength training, are there other things you want people doing every day as the stuff that we could do without a physical therapist?
Yeah. So I mentioned that meditation I recommend to all of my patients.
Why?
And that is because the diaphragm has a close relationship with our pelvic floor. So the diaphragm is up here, pelvic floor is down here, and when we breathe, pelvic floor is supposed to move with the diaphragm.
Oh.
Right? So if we're held in a state of tension and stressed out, we're likely not breathing properly. So in addition to the exercise that we mentioned, doing breath work. Could be in your meditation, could just be simple breathing exercises. I often have people put one hand on their chest, one hand on the belly diaphragm area, and just breathe in. Feel the breath go all the way to the pelvis, and then exhale.
And just that touch really can help us relax. Yes. I call that even mindfulness sacks throughout the day. If you're having real stress, like take an extra moment in the ladies' room, do 3 deep breaths with this on there.
Yes.
These are actionable things we can do.
Yes.
And we're not going to have enough time to get into this, but I do want to let people know that you're actually having success and helping people who deal with a very painful condition of endometriosis. So physical therapy can be really helpful for endometriosis also?
Absolutely. So many of the symptoms for people with endometriosis is pelvic pain.
Okay.
So with pelvic pain, the pelvic floor muscles become tight. Research has shown this, that the pelvic floor muscles become tight and they're not able to contract or lengthen fully. So with pelvic floor PT, with different hands-on techniques, with radio frequency, that's the modality that we use, you can help to normalize the muscle tissue and then reduce the pain.
Doctor, thank you so much for being with us. And you can follow this information by following me at Cara Sundlin. Of course, the doctor shouted out her Instagram as well. I hope this was useful and informative. Have a great day, everyone, and be well.